Did you know in the United States, 64% of dogs are neutered, but in Norway, illegal unless for medical reasons, fashion, or science? Reality is shelters are full, and debate rages hotter than a heat cycle in August. Today, bring scientific truth sterilization, debunking myths and share opinions. Because here, your neighbor's opinion isn't evidence, and forums don't replace science. Ready to make responsible decisions about your dog? Subscribe, and let's get to the point. Sterilization prevents unwanted litters and reduces abandonment. It's that simple. Fewer homeless puppies, more happy hearts. For our female canines, if you spay before the first heat cycle, the risk of mammary tumors drops to 0.05%. After one heat cycle, it rises to 8%, and after two to 26%. Additionally, it eliminates pyometra, a fatal uterine infection. It also completely removes ovarian and uterine tumor. Similarly, spaying female cats before 6 months results in a very low risk of mammary cancer, 9% compared to intact cats with multiple heat cycles. In males, castration eliminates the risk of testicular cancer and greatly reduces prostatic problems. Most unneutered male dogs develop benign prostatic hyperplasia with age and enlarged prostate. Studies indicate it occurs in 80 to 90% of intact adult males. It also decreases the incidence of prostatitis and prostatic cysts. After sterilization, improvements are observed in pet behavior related to sexual instinct. Importantly, in females, by not going into heat, annoying behaviors like meowing or restlessness in cats are avoided, as well as bleeding and nervousness in female dogs during heat. In males, with the disappearance of the main testosterone production, the urge to escape or roam to find a mate decreases, as well as the tendency to mark with urine indoors. For example, it has been documented that wandering or roaming decreases by up to 90% after castration, and territorial urine marking behaviors are reduced by about 50% in male dogs and 85% in male cats after neutering. There also tend to be fewer fights over territory or for females in heat. Did they live longer? Yes, but also because they usually receive better veterinary care. Not everything is surgical magic. Thanks to all the previous benefits, sterilized pets tend to live longer and with better health. A large-scale study found that neutered dogs lived significantly longer than unneutered ones, partly because they have a lower risk of death from infectious and traumatic diseases. However, by living longer, they could develop diseases typical of old age, such as cancer. Studies from the University of California, Davis, indicate that sterilizing before 1 year of age increases the rates of hip dysplasia, cruciate ligament rupture, and some cancers in large and giant breeds. For example, a Mastiff neutered before 1 year has a 28% risk of cancer compared to only 7% if not neutered. Female pointers spayed before 6 months, 38% with joint problem. Obesity risk increases between 50 and 100%. After sterilization, as sex hormones decrease, animals' basal metabolism slightly reduces, and many owners notice pet gains weight more easily. However, this is controlled by adjusting diet and encouraging exercise. Obesity isn't an inevitable consequence of castration, of excessive calorie intake relative to energy expenditure. Love giving our dog little cheese, bit of pate, slice of chorizo. With diet appropriate for new condition and activity routine, your spayed or neutered pet maintain healthy weight issue. A 2024 Vet Compass study found spaying female dogs between 3 and 6 months increased early urinary incontinence compared to 7 and 18 months. Castration doesn't cause it, but increases the risk in certain large breeds. Hormonal changes. Removing ovaries or testicles causes a persistent increase in luteinizing hormone, which is linked to metabolic alterations and possible tumors, although this is still being studied. For cats, the American Association supports pediatric sterilization before 5 months to prevent unwanted litters. It warns cats can be fertile as early as 4 to 5 months. Small and medium dogs, like Boston Terriers, Bichons, Pomeranians, etc., can be sterilized before their first heat without orthopedic problems or additional cancer risk. For large and giant dogs, such as Golden Retrievers, Boxers, Mastiffs, better to wait at least 1 year, even 2 in high-risk cancer breeds, like Boxers, suggested to castrate beyond 2 years due to high cancer rate. In female Golden Retrievers, early sterilization increases the incidence of tumors. It's recommended to wait until 1 year. Furthermore, in large and giant breeds, their bones grow slower, early surgery can discoordinate growth plates. Has your female dog had her heat cycle? The evidence regarding the reduction of mammary tumors by sterilizing after the first or second heat is weak and contradictory. Always individualized. Do you have any questions? Leave your dog's breed in the comments. and I'll give you my personalized recommendation. Myth 1. Castration causes weight gain. Half myth. The surgery reduces metabolism and changes hormones, so the risk of obesity increases. But overweight is prevented with proper diet and exercise. Don't blame the surgery, blame the treats, the cheese, the chorizo. Myth 2. They become calm and less aggressive. False. Recent reviews indicate that castrated dogs can be more aggressive and show more fear and stress. Castration is not a behavioral therapy. Myth 3. Female dog needs litter? No. There's no physical or psychological benefit. It increases cancer and pyometra risk. Myth 4. Always at 6 months. Obsolete. Each breed and size has its moment. A Golden isn't a Chihuahua. A single standard ignores genetic diversity. Myth 5. Removing hormones changes personality. It depends. Some studies indicate that sterilizing reduces sexual reactivity and certain behaviors. However, others show an increase in anxiety and depression. Socialization, training, and environment influence personality more than hormones. I wanted to dedicate a special chapter to the topic of anxiety, fear, and stress, and how this relates to sterilization and behavior. It causes an increase in fear and stress. Recent studies between 2024 and 2025 report neutered dogs show more anxiety, stress, noise phobias, and aggression. Spayed females before 1 year more fear behaviors, and neutered males before 5.5 months sound phobia. Is your dog anxious? Don't use castration as therapy. The veterinary practice indicates that early castration can exacerbate anxious responses, and reversible chemical castration is a less drastic option to evaluate the effect. Work with ethologists before decisions. Decreased testosterone and estrogen reduces oxytocin and dopamine, increasing stress sensitivity. Every dog is universe, no magic recipes. No universal age. Sterilizing prevents disease and controls population, but it can increase risks if done too early. Always consult veterinarian. Individualize according to breed, size, and health. Alternatives like vasectomy or chemical castration through an implant lasting 6 to 12 months. It's not bad. Whatever decision, positive training, socialization, and diet controls are key tools to maintain dogs' health and well-being. And you? Have you already sterilized your pet? Do you have any questions about your case? Leave them in the comments with the breed and age of the dog. Give it a like if you learned something new, and subscribe for more real veterinary science. And if you want to know more, watch these videos about cat and dog vaccines. See you in the next vet story.